Welcome to the DNX podcast, the number one resource for entrepreneurs, nomads, and impact-driven souls. And I am your coach, Sylvia Christman. Welcome back. I'm here today with Dr. Rhea Mehta, who is the CEO and co-founder of Bowhead Health. Hi, how are you today?
I'm wonderful. Thanks. How are you?
I'm well. Thank you so much for making the time. Now, you have a wonderful story because not only do you have a PhD in molecular toxicology and nutritional biochemistry, you're also a certified integrative health coach. And so with that, you've really built a career of focusing on how we can optimize the broken healthcare system.
That's right.
Yeah, so I'm fascinated by your story and I love talking to you. So that's why I wanted to have you on this podcast. So can we start by talking about why you think the healthcare system is broken?
Sure. So thanks again for your willingness to have this conversation. I think most of us, who have had personal experience with healthcare or who read the news, understand that our healthcare system, not just within our own jurisdiction, but globally, is broken, and healthcare costs are through the roof. I think the World Bank projects that by 2040, healthcare costs globally will reach $18 trillion. So, the healthcare costs are still on the rise. And despite this, people are still, they're still falling ill. And they're lacking access to quality healthcare and prevention. And something to note here is that out of all this spending, a lot of it's going towards chronic diseases, and a big chunk of chronic diseases are preventable. There's actually, we think we all kind of understand that behavioral change plays a very big role in preventing some of these diseases from escalating and reaching, just more unfortunate symptoms and states. And so it seems as though we're focusing on a lot of the wrong things, and we're paying a lot of people to kind of continue to work within this model. But what's really important here is that I think it's time to actually challenge the system itself. And the good news is, I actually believe that we have the technology today to actually challenge a lot of the issues within the healthcare system.
And what technology would that be?
So, there's a few different emerging technologies out there. Obviously, artificial intelligence plays a big role here in machine learning. But the one that I'm most passionate about, and specifically around fixing some of these key issues in healthcare, is blockchain technology. And so I'm assuming you're very familiar with blockchain technology.
Oh, I happen to be, yes.
Okay. And so, I think blockchain technology was, of course, traditionally, thought to and worked on to solve the financial crisis and the rework financial systems. And in the last couple of years, there have been a lot of other really interesting use cases, and one of those use cases in healthcare. And there's so many issues within healthcare that can be resolved through this technology. And so one of the big issues is the lack of portability of data. And this is generally because of incompatible systems. So we have all kinds of systems around the world that don't communicate. And these are systems that hold our personal health data. And if they don't communicate, whether it's in your own town or city or country or globally, that's a big problem, because now all of a sudden you have all this data that can't be transferred, and people having to do repeat tests, repeat medical procedures, which is incredibly discouraging, but also costly to, as I said, an already costly healthcare system. So the lack of portability is a really big issue. The other one is security. In 2017 alone, there were several large-scale health data security breaches, and many of them were due to these centralized systems. And of course, also working with, quote unquote, trusted third parties. That's another issue that this technology can resolve. And if we're able to kind of resolve some of these really two big issues in healthcare, then we can all of a sudden now give patients or consumers, users, access to all kinds of diverse data, and also try and understand how to unlock that value. And that's where I'm most interested, personally and professionally, as my role at Bowhead, is to really understand, how valuable is our health data. And I think we already know that. I think we know the answer to that. I think the Cambridge Analytica case with Facebook really brought to light the value of data, just personal data. And I think a lot of people, everyday people started to ask these questions. Well, can I actually get paid for my data? Am I just giving away too much of it? And also, who is benefiting from it? Are other people making money off my data? And that's, and just kind of feeling empowered and thinking through, like, whether people themselves can be better protectors of their own data. And again, that's where the technology can really help.
Yeah. Oh, yeah, I completely agree. So for anybody that doesn't really understand blockchain technology, could you give us a brief overview on how that would work and change, centralized health data security issues?
Sure. So the technology itself, what it allows, and not kind of going into the tech, but going into sort of the philosophy around it, it allows for the secure transfer of a valuable asset between two anonymous parties. And so all of a sudden now you can share something valuable. You can share, whether it's money, or it's purchase some personal health information about yourself, or it's, your social insurance number with an anonymous body, and trust that whatever you send is going to get there. And also whatever you're sending is not going to get lost, because there's a public ledger, basically a spreadsheet that records all of these transactions. So it's essentially impossible through this feature called immutability to go back and, lose that data or whatever you sent, or to modify that. In healthcare specifically, there are a lot of issues around whether in clinical trials, for example, whether researchers are publishing results, or in medical billing, where, some services are unknowingly added, or, added by a third party to your bill, to your medical bill, and this is kind of this is overlooked by the patient, and of course the patient ends up paying more. So there's a lot of issues around trust, and this is a trustless model. So the technology itself has trust built into it, so you can just essentially be a participant in this model, in this technology of sharing something valuable, and trust that it's going to get to that. Whatever that destination, whether it's another person or a company, and this is it's highly secure. It's done through cryptography. Cryptography is not new, but essentially you have these hashes, or these references that are sitting in this ledger, and that's what is connected to this data that you've transferred. So in healthcare itself, and what we're building, we're not necessarily going to have the data on the blockchain, because of course data is incredibly valuable and private. We'll have it in a decentralized hard drive, fully encrypted, but those references, these codes, these hashes that are linking to that data will be on this public ledger. So anytime that you submit data, there's a record that's basically shared with all the different parties, whether it's private or public, but in this network. And then there's other really interesting technology called smart contract technology, which is essentially a contract that self-executes. So now all of a sudden you don't need a third party to kind of verify, a certain agreement, and of course take an unfair cut often from that agreement, or transfer and exchange. So now all of a sudden you can have patients securely share their health data with different kinds of practitioners, with different healthcare stakeholders, and also you can have a safe exchange of if someone is buying your data, or if someone is giving you something in exchange, you can also have that exchange very securely done and self-executing through the smart contract technology. So it's basically a protocol that you have we have coders build into the system. So it's becomes a really secure way of transferring something very, incredibly valuable. And as I said, with healthcare, we have clinical trials that can be improved through this technology. We have claims adjudication and payment processing. We also have supply chain. So there's a lot of issues around counterfeit drugs. And again, if you have a proof of ownership built in to every step of the supply chain, if you're in that space, of drug manufacturing, now all of a sudden you can start to really hold people accountable to basically just being truthful.
That's so fascinating. So, and this is built in a way that it's applicable globally.
Yeah, so the kind of philosophy behind blockchain technology is that we're not bound by borders. So and that's something that I feel very strongly about. If I'm traveling to East Africa and I get sick all of a sudden, I want to be able to have direct access to my health data. So so the way that we're building it is that you have. Right now, it would be your mobile app. So you have your app with you. You are the owner and control of your health data. So you have access to new data that you generate. And eventually it'll also be connecting you to historical data from other health systems. And that's done through an API. And then through your private key, through this code that you've created, this unique code that belongs to you, you can basically access your data anywhere in the world through this. So
yeah. So here's a question: who enters the data? Is it so let's say I run some test results, and I'm sure that I, like many people, have had some false test results before that had to be redone and then came back differently. So who enters the test data in there, and can you change it?
Yeah, so it's a good question, and this is where this technology is obviously it's nascent. This industry is nascent, so we're still trying to figure a lot of things out, and we're still trying to get clinics and hospitals on board, which means that for them, they're very comfortable. Their security team, IT team is very comfortable with their current technology. We have to get them on board to now using this technology, right? So as a starting place, because we need to start starting with getting users and having them get comfortable with just the idea alone of being owners and managers of their health data. Like that alone is a mindset shift. So what we're doing is we've launched this app and we're getting people comfortable with tracking healthy behavior, so submitting data that they're generating in real time through tracking daily health, through completing health surveys and their medical history. So all that data that they complete that's considered new is now being stored in this record. So essentially, they're building their encrypted health, lifestyle, wellness record, and it's done, using new data. But then the next step from there is to have them upload historical data onto the platform. So, we know that we should technically have access to our health data. A lot of patients don't have access and think that they can't, or have to have to pay money to buy back their own data. So if people themselves have access to their genetic data, their certain MRI data, et cetera, they can then upload that onto the platform and store it in this safe place. And then the next step from there is start working with these clinics by sharing our API, so that now we have a doctor-facing app that's sitting at that doctor's clinic. And now it's very easy for you to now transfer all of your historical data onto the blockchain. And now it's only accessible to you. I mean, your doctor might have that historical data. That's fine. But you as a patient or a user will now have access to this record that can be incredibly valuable, especially over time, especially if you have now this longitudinal health data sets from age 10 all the way through to age 50 with your various blood tests, et cetera. So it's a long journey ahead, which is why we're starting with getting people to start creating new data. And so we're not only getting people to create sort of self-reported data through tracking and submitting surveys, we're also partnering with labs, genetic labs, so that people can start to understand their genetics, their nutrition profile, and their pharmacogenetic profile, as well as ordering tests from labs that sell you that help you detect biomarkers that might have some issues that are kind of linked to early detection of issues. So hormone imbalances, vitamin deficiencies, that's sort of where we're focusing as well. So very easily on the app, you can start to order these tests. They show up in the mail. You place your saliva or blood spot sample, you send them back, and then all that data is then uploaded with your consent onto your blockchain and only accessible to you with your private key.
That is so fascinating, because you're also providing the testing. Yeah, because yes. I just went to my annual physical, as one does, and I got my lab results back, and all of them, the things that they test for are so insignificant and irrelevant. There's so many things that are not tested for. It's just sort of, okay, I'm not anemic. I don't have any, like my cholesterol is fine. But it's very surface. I was surprised every time I look through them. I'm surprised how surface level this testing is, and that there's so many other, as in hormonal levels, levels of testing that you could do as a gut health, right?
Exactly.
That I relate it to chronic illnesses that are not being treated or tested for until obviously very severe chronic symptoms start appearing.
That's right. And that's one of the issues right now, I think, with the sort of medical and wellness and functional integrative health systems is that, there's not enough support of early detection or preventative type strategies. And that's why we do need a lot more data and quantification in this world of wellness, because, we have these medical doctors who are now practicing functional medicine, which is excellent. But then there's a whole other group of medical doctors who don't support these functional tests, these tests that measure sort of underlying inefficiencies that actually 10 years from now could lead to a much more serious chronic illness. So we want to provide people with access to these tests because we truly believe that if people have more information about themselves and they're able to access that data, that they'll feel more empowered to take care of themselves and, of course, then live long, healthy, happy lives.
Mm. Yeah, I agree. And affordability is a big component of it, because a lot of these tests are just not, people just can't, I mean, at least in the States, they can't pay for it, or they're uninsured.
Yeah, so that's another great point. And so, with the innovation around pregnancy tests, with fertility tests, a lot of these tests are quite affordable. You can buy them in the pharmacy and buy them for under $20. So the future of healthcare, and something that we're also working on, is developing point of care diagnostics or point of care tests that will be much more affordable. So point of care tests that measure your vitamin D, your thyroid, your entire hormone panel, but that would cost under $30. Because, as you said, it's very expensive to order some of these tests, and then because it's so expensive, you don't actually follow up. And so if you have chronically elevated cortisol, which is a marker for stress, and you've spent $500 or whatever it is, $100, $200 on a test, you might not feel motivated to then track yourself 3 months later after you've done a bunch of lifestyle adjustments, which is kind of contradictory to the entire process. You want to be able to retest to see whether you can, if your treatment is going well, or if you need to kind of shift your protocols. So because these tests are so inaccessible today, it does make it difficult. But with that being said, they're also protecting you from later stage chronic illness that could be potentially very expensive. So another piece in this is education. People need to understand that if they put a little bit of investment up front, and I think this goes back to the mentality around what's your monthly budget? How do you allocate your salary? And obviously this is for people who have the ability to do that, to spend money on their health and other kind of lifestyle ish things. That it's interesting because a lot of people will say that, well, I spend $500 a month shopping, buying shoes or whatever it is, and that's just normal, or buying a new outfit. But it's a bit of a mindset shift as well. And in that we're, trying to empower people to think, well, if you invest in yourself today, that is going to actually save you like so much, in the future.
Yeah, 100%. It's about the awareness that we need to drive, that people can do something about it. I think also, I see it so much that people are just not aware of what their state of health really is, and traditional tests really don't say a lot.
Yeah. So that's correct, and I think that's a big problem. You get these data sets back, and they don't really make sense to you. So how do you feel empowered to change your behavior if you're just looking at a bunch of numbers that don't really make any sense to you? So that's something else we've taken into account. We want to make sure that like we're kind of thinking, sitting in the patient's shoes, and we're thinking, what is it like? How am I going to feel motivated? Because, like you said, that's the most important thing. Awareness leads to motivation and behavioral change. So we're working very hard on making a very user-friendly experience with the app. So UX is really important, and we've also thrown in some gamification in a big way. So if you track your health for 7 days, you unlock the first rookie badge, and that badge will give you a certain health tip, and then you'll unlock AHT, which is our cryptocurrency. So we're also using this currency, which is part of this this blockchain ecosystem. So we've come up with our own currency to then use as a reward or incentive to people, to patients, users, for tracking their health as a way to keep them more motivated. And then we have a marketplace with products and services, and we'll give people the opportunity to then use this this money that they're earning from just tracking their healthy behaviors, from uploading data onto the platform, in exchange for products and services. So we're not, in this moment, we're not saying, well, you can just buy anything. We're actually trying to send them to a marketplace where they can now purchase products that are actually helping them, optimize their health.
Yeah, I love it. I want it. I love it. I think it's such a great idea. It really is.
Thank you.
Because it gives, anybody that's listened to this podcast or me has met me before knows how important I think it is to hack the healthcare system, not just within the context of our individual countries and places that we live, but look at it from a more global scope and what it is that we can do to improve it, especially because most of us nowadays, work globally, right? We work in so many different countries and cultures. And I think I've been tested and had to do lab work or gotten ill in almost every country I've visited. I'm very prone to picking up things, but I have no way of accessing any of that, right? Like I have no idea. I was hospitalized in so many different countries and continents on this planet. I have actually no idea, unless they gave me the records upon leaving, what it was that they found or what I was treated for.
Yeah, and that's really unfortunate. And and so it's like, as patients, we're losing out on this valuable data that could potentially help us. And then there's also the system. Like if someone has a rare disease, and all of a sudden now researchers have access to that data, patient advocacy groups have access to that data. It's going to not just help me, but it'll help the entire system. So we just have to really we have to start to test out this method, which is getting people comfortable with being the managers of their data, and that requires a certain level of self-responsibility, right? It's like and I think that with self-responsibility, like that could actually lead to behavioral change, because all of a sudden now you're realizing that, wow, I'm part of this. I'm just, and I mean, of course you are. It's our data, but traditionally it's weird. It's like, I'm going to the doctor, I'm getting my blood test, and yet most people don't even see that data. Again, they have no idea what it translates to in real life. Yeah,
it's self-responsibility is also driven by knowledge. I time and time again, I'm incredibly underwhelmed when I go see a doctor because I have an issue. I am absolutely flabbergasted by the degree of, it's more lack of interest in what's going on in my life. And usually a very symptomatic approach to the issue rather than perhaps taking the time to look at what could be the underlying causes of what's going on, So, yeah. I mean, like I've had adrenal issues. So obviously I monitor my cortisol levels, I look at my hormonal levels, that will reflect on my sleep patterns. But if I go to a doctor, a physician, and I inform them of that, they'll be like, oh, you can take sleeping pills. I'm like, no, I'd rather just monitor my cortisol levels and see if like the meditation and lifestyle changes I have incorporated in my life have improved these results. Just, can we go there, please? No?
I know, I get it. And I'm, it's a bit unfortunate that the medical system is not based on this, this root cause model. It's unfortunately the way it is, and I think all we can do is just become more health aware ourselves and start asking the right questions, and also really start to support these various areas of lifestyle medicine, wellness, scientific wellness. I mean, this lifestyle medicine became a new field, in the last, I think it was 6 to 8 weeks. And so once the medical system, these hardcore doctors and scientists start to see that actually this is a real area, and it can lead to real change. But if they start seeing more and more data focused on this area, then they'll start to buy into it too. And all of a sudden now we'll have, doctors communicating with nutritionists and holistic practitioners and all kinds of different modalities, kind of just communicating better. So I think we really need to free the data so that people have better access to it. And then we can start to see, oh, wow, that information about what I ate for breakfast for the last 6 weeks actually changed my life.
Yes.
And when doctors can start to see that too, then all of a sudden now we'll start to have, these conversations that actually lead to action.
Yes. Free the data. Just free the data. Thank you so much for making the time. I really appreciate it. We're going to put the links of where to find you and your mobile app below this podcast. And I can't thank you enough for taking the time to be here today.
Thank you so much.
Thank you so much for tuning in and listening. I hope you enjoyed it. Before I leave you, I want to invite you into my world. Join us at the DNX Festival in September in Lisbon. If you go to our website and use the promo code podcast50, you get an extra 50 euros off your ticket. And subscribe to this channel and leave us a review if you can. We will review these frequently, and you can leave us a question that we will answer live online. Until next time.